nurses.
Hello!
Hello, community members. Hello! Occupy Wall Street, anything them here today? Maybe not, that's right. My name is Sam Aldi. I'm a nurse, and I've been a nurse now for 30 years more. And I'm the Associate Director of the Manhattan VA in this city. Today, National Nurses United represents 170,000 nurses across the country. And we are in 20 cities right now talking about this very launch of the Robin Hood campaign. One of the biggest parts of the reckless symbol of Wall Street with speculation is represented by the building that you are standing in front of. But they were not alone. Trust me. They were not alone.
Just got withdrawn.
The irresponsible actions have hurt the communities, families, and businesses. We can change all that if we want. But worst of all, what it also hurt is nurses and patient staffing ratio. We don't have enough nurses for our patients in this city and across the country. This is what the National Nurses Union is here for, to raise awareness that we don't have proper care for the private sector, and guess where else? The VA hospital veterans are not having proper care because of the bailouts that they have given the big banks. We can fix all this today. It's not difficult to do. The way we can do that is by the Robin Hood tax. The nurses, the National Nurses United, support this because we want to heal our country. We are nurses that want to take care of sick people properly. We are nurses that want to take care of sick people with a proper amount of nurses, nursing assistants, supplies, and equipment. This tax, which is only 50 cents on $100, can go back to the care of the patients, businesses. This tax can raise enough money for health care and education. The Robin Hood tax can also give us jobs. Money that can be given back to the people. This is what this is all about. We need the money to come back to us.
Take your money out.
Yes.
We are now speaking out. We demand, the beginning of today is a demand from Wall Street to have the Robin Hood tax.
Yes.
Now it is time to make it right, JP Morgan Chase. It is your time to do the right thing. Now it is time to give the nurses the medicine needed to heal this country.
Starcher from Healthcare Now.
All right, John.
Oh, yes. All right. Healthcare Now stands together with the nurses, fellow organizations, and community groups calling for a Robin Hood tax. A tax of 0.25%, just 1/4 of 1 penny on all stock and bond trading could raise hundreds of billions of dollars to boost up the economy that Wall Street nearly destroyed. With just a small portion of the Robin Hood tax, we could afford to provide truly universal, single-payer health care to everyone by improving and expanding Medicare for all. Americans across the country are calling for this at the state and national level. New York is one of 22 states with a bill that would provide such a universal, single-payer healthcare system. We call on all New Yorkers to support Richard Godfrey's New York Health Bill. Sign the petition, support the bill. Across the nation, 50 million Americans live without health insurance every single day, mainly because they can't afford it. It doesn't have to be this way. Hardworking Americans bailed out Wall Street, and now it's about time we get a return on our investment. The solution is clear. We need to expand and improve Medicare for All with a Robin Hood tax now.
Speaker is Michael Tequili from ACT UP.
Hi everyone, my name is Michael Tequila and I'm from ACT UP and Health Gap. There are approximately 34,000 people living, actually million, make that, 34 million people in this world living with HIV and AIDS. Out of that amount, only 1/3 of them have access to life-saving medication. Is that right? No! Of course it isn't. Our government has made strong declarations to have a generation free of HIV and AIDS. Yet, when we ask them for money to scale up and give everyone treatment, they say we don't have money. Well, that's wrong. We know we have money. And that money's in Wall Street. Tax Wall Street. End AIDS. Tax Wall Street. End AIDS. Tax Wall Street. End AIDS. Tax Wall Street. End AIDS.
Lori Went from Physicians for National Health Program.
Hey, Lori.
Thank you. There's a very simple reason why I'm here representing doctors, Physicians for National Health Program. And here it is. Healthcare, yes. Healthcare, yes. Insurance company, private insurance companies, no.
Right.
Doctors stand with nurses because, like nurses, doctors know that corporate greed is incompatible with providing good health care. Like nurses, doctors know that they were trained to take care of the sick and the suffering instead of spending half of their time fighting insurance company denial. Like nurses, doctors have seen too many amputations, too many deaths that occurred because patients could not afford to get the treatment and the medication they need, and then it was too late. So we're here today because corporations like JP Morgan Chase and others are decivilizing us. What does that mean? To me, a civilization is a process we're trying to get to the place where everybody has the potential, where everybody can fulfill their potential. And these corporations are decivilizing us because they're taking us backward. This country had a Robin Hood tax for 50 years, and we can do it now. We need to go in the other direction, not the direction that they're taking us. So back to my shirt. Healthcare, yes.
Sorry.
Excessive profits and greed, no. Human needs, yes. Wall Street keeps getting richer, no. Wall Street and the 1% paying their fair share, yes. Private insurance companies, CEOs making millions while denying care to patients. No. A universal, publicly financed, high-quality, single-payer healthcare system.
Yeah.
Finally, political leaders who conspire with Wall Street leaders and protect them when they tank our economy. No. How about doctors and nurses helping legislators locate their backbones? And finally getting a small step toward an equitable society by instituting the Robin Hood tax.
Yeah.
Out here just because healthcare is a big reason that a lot of people are tied into jobs they don't want to do. Like Right now I work for an advertising agency that handles a major bank. And it's just a job I could find. And I want to quit, I want to leave, but I've got really good benefits. And so I've got to wait till I find another job with really good benefits. And most of them, you've got to buy into, you got to support the beast if you want health care. So I'm really big into anything that starts pushing us towards universal health care, not tied to employment, so that I could have more freedom to work for companies that I don't find morally reprehensible.